Welcome back. Today we have prepared for you a talk on hallucinations, specifically auditory hallucinations, which, as you know, are a key symptom of psychosis, but also occur in people who are not diagnosable with a psychotic illness. And that is the takeoff point for this intriguing study by Phil Corlett from Yale University that we will discuss today. He has performed an experiment which lends support to the idea that the concept of the predictive brain or the Bayesian brain may be able to explain the mechanism by which people experience hallucinations. And this weaves into a larger tapestry of findings that we have discussed previously on the predictive brain. We will now go to a video that we have prepared in the past, which we will replay the first few minutes because I have explained the background and the previous talks on the Bayesian brain in this particular video. So I'll see you back on the other side of this video and we'll continue at that time. Today we will give you an update on our lecture series, The Bayesian Brain. In fact, another way of putting this is the predictive brain. I'd like to review briefly with you the content of the first three lectures. You may recall that in lecture 1, we outlined the idea that perception is not just a feed-forward acquisition of data from the environment via our senses, such as hearing, and seeing and touch and proprioceptive information, but rather the brain uses the incoming information to draw inferences about what's going on in the world. Inferences of causality, because it's important to decode the incoming sensory data to make sense in terms of causal contingencies in the world if you want to survive in this world. Now, the idea goes way back to Wilhelm Helmholtz in the 1800s in Germany, and we outlined the idea that perception is matching the sensory information that we receive from second to second with prior information, the so-called priors. And we outlined the utility of these ideas in understanding the glutaminergic model of schizophrenia. Now, in the second lecture, we focused on sensory-motor integration. How is it that you can return a serve of a tennis ball approaching you at something like 80 miles an hour by looking at the racket position of your opponent, the trajectory of the ball, getting your right hand, your forehand in position, and returning the serve. All these things have to be done very rapidly and rely on prior information that is already available in the brain. We also use this idea of making sense of what happens in depression. There is a bidirectional relationship between some medical illnesses and depression. In other words, depression predisposing to some medical conditions, and medical conditions such as diabetes, for example, predisposing to depression. The reason for that may be buried in the brain in terms of a Bayesian inference machine from the insula to the medial frontal cortex, especially the subgenual frontal cortex or Brodmann area 25. And in the third lecture, we talked about that infants use the violations of prior ideas, prior expectations, as they view certain events in the world as a method to draw inferences about what's going on in the world. 12 months old infants use already valid optimal Bayesian statistics in terms of predicting what's going on in the world. And finally, in lecture 3, We talked about schizophrenia again and the fact that dopamine, a key molecule in the history of schizophrenia, of course, is involved in error detection and the evaluation of stimuli and the comparison of expected reward and received reward. And we made the point that patients with schizotypy or a genetic predisposition to schizophrenia often have an advantage in detecting ambiguous stimuli in the environment by relying more exclusively on the prior information already laid down in the nervous system. Welcome back. So you have now seen my summary of the first 3 talks on the Bayesian brain, and I will not recount all the different things that we have reviewed at that time. But I will play you yet one more video, namely another piece of a video on the predictive brain, which highlights the power of the so-called priors, or prior information encoded in the brain, which will override your perceptions and your better judgment as to what you should be perceiving, and the brain tells you something different that it is perceiving. In a way, a delusion or illusion of a visual percept. This is called the hollow brain illusion, and I will have you look at this and see you back on the other side of this video. To our third lecture. This lecture is somewhat difficult in terms of the concepts involved, but close attention and research really will pay dividends. We'll be talking about what has been termed the Bayesian brain. And to introduce a rather stunning example of what our brain does against our best intuition, I will show a video. You may be able to see the URL superimposed on the image here. So you have now watched the video and you have noticed in this hollow face illusion that despite your best intention and your best efforts to see the hollow face, your brain is preventing you from implementing the image in your mind. Why is that? Well, we all know that faces stick out. Noses don't go inside, noses come outside, and the contours of the face are going into the world rather than away from the world. This notion, this experience, this conviction is encoded in the brain and reinforced by millions of times of watching faces and seeing faces. It's cemented into our neurons and hardwired. In Bayesian terms, this is a so-called prior, something that's already there before you gather new experiences. Okay, the Bayesian brain. Bayes was a gentleman in the 1700s who came up with a new way of statistical thinking. And in the first slide, we summarize some of these thoughts. For many decades, neuroscientists have understood the brain as a stimulus response organ. So visual images come into your retina, photons bombard your retina. These are transduced by the appropriate pigment and cells in the retina, and the images then are transcoded and encoded and relayed into the visual cortex, going through V1, V2, etc., until the image is somehow recomposed and represented in your, quote, mind's eye, close quote. Well, welcome back. So you now have seen the hollow face illusion, and it gives you a sense of the power of priors in the brain. Priors is a Bayesian term. It refers to those items that have already entered your consciousness and have been encoded in higher cortical areas. And the notion is then that these priors, in a way, work together with new incoming information to decide what is relevant and what is news. And only the news, namely the error terms of information, sensory information that does not agree with priors, is propagated through the cortical hierarchy and used to construct an image of the world, or in our case today, an auditory image of the world. So here in the first slide, you see a painting by Vincent van Gogh. And you see not one sun, but you see three suns in the air here. As you know, Vincent van Gogh had a diagnosable mental illness. We don't quite know what it is, but he certainly had mental breakdowns. He sliced off one of his ears in a psychotic state. And nevertheless, he would see things that we could not see until he painted them. Something in his brain gave him access to perceive the world in a different visual way than people without his particular capacity are able to see. And the next slide, you can see a photo that comes from an article in Science magazine where this was published, stating that even healthy participants can experience conditioned hallucinations. The mechanism that causes auditory hallucinations may be related to those used in normal perception. So that is the overarching theme. And let me break this down for you. So a team from Yale University set out to understand how we interpret the world around us, to determine what is real and what is not real. They suspected that people who regularly hallucinate perceive the world based on what they expect to happen, while others who don't hallucinate would rely more on the senses and what the senses are telling them is happening in the world. Of course, the expectation of what will happen is closely related to the notion of the Bayesian priors. Now, the main author here is Phil Corlett, and he has published a previous paper on the formation and maintenance of delusional beliefs. And we have added a video that he produced and put up on YouTube that you can access if you click on the presentation part of this lecture, and the video will be there for your review. He's a quite ingenious fellow who has come up with very decisive designs to answer some difficult questions in psychology and psychiatry. So what they did then is to condition participants to hear a tone. And at the same time, these folks were seeing a checkerboard pattern. Then slowly the sound was removed and the subjects were asked whether they still were perceiving the sound. Participants who regularly heard voices were 5 times more likely to say that they heard the tone when there wasn't one, and they were 25 to 30% more confident in their choice. And they weren't alone in hearing things. In fact, all of the participants experienced some induced hallucinations during the experiment. So there's a comment here by Phil Collette stating that really healthy people that don't hallucinate in their everyday lives, such as graduate students and postdocs, highly accomplished people, were very susceptible to this effect in his experiment. Even those folks were able to hear voices, and they were much more susceptible than I, namely Dr. Collette, had expected. So the study contributes then to the idea that schizophrenia, much like autism, exists on a spectrum, the authors say. So they identified 4 groups for study, namely those with diagnosed psychoses who either did or did not hallucinate, and each group had about 40 to 15 participants. Most of these were easy to recruit, but the authors also needed to find people who were experiencing hallucinations as part of daily life, yet have not been diagnosed with a psychiatric disorder. So they had the ingenious idea to turn to the Connecticut Psychics Association, specifically to psychics who regularly hear voices. So this is the group over here then. No psychosis, but auditory hallucinations. And finally, a control group of people who never heard voices and also were never diagnosed with a psychotic disorder. So that then these are then the groups that were subjected to the experiment. And here is how it went. So Pavlovian conditioning was used. Now Pavlov is known for exposing dogs to the sound of the bell and then subsequently giving them a meal. Eventually the dog started to salivate even if just the bell rang and the meal was not really there, because they had formed a link between the sound of the bell and the expectation of a hearty meal and began to salivate. So the same principle was applied here, namely, the subjects were conditioned to associate a checkerboard pattern with a 1 kilohertz tone, which sounds like a bleep over a swear on late night TV. Initially, the scientists sprinkled in lots of 1 kilohertz tones that were certain the participants could hear. Then, as the task went on, they changed the intensity and often removed the tones entirely. Like in a hearing test at the doctor's, participants were asked to press a button when they heard the tone. In an added twist, participants could indicate how confident they were about their response. Meanwhile, their brains were examined using magnetic resonance imaging, MRI, which gives you a metabolic picture of the brain and an indirect picture of neuronal activity in specific brain circuits. So then, using this neuroimaging technology, the team was able to show that the underlying mechanism that causes auditory hallucinations are related to those in normal perception. In other words, hallucinations prey on the same process that allows us to hear and see. So here's a comment by Dr. Collette. We are able to say that hallucinations are not just foreign, scary, unrelatable things, but they are a process or an alteration of a process that we ourselves undergo every day in deciding what surrounds us. Now, this had been known for quite some time. Here's a paper that appeared in 2016, a meta-analysis looking at auditory and verbal or both hallucinations. Then a subtraction was used to take the signal intensity from one modality versus the other away from the finding, and you can see what is left over, namely that auditory hallucinations specialize here in the temporal cortex where audition is usually processed, but also in Broca's area over here, and to some extent in Wernicke's area over here. All these are circuits that are involved in perception of speech, decoding of speech, and production of speech. So in other words, these patients who were hallucinating utilized the same neuronal machinery that you and I use to either speak or perceive sounds. So here then is the paper, Pavlovian conditioning-induced hallucinations result from overweighting of perceptual priors. Now that's a mouthful and we have to break this down. But as you now have seen, perceptual priors belong to the Bayesian or predictive brain framework of understanding the decoding and processing of both sensory information as well as the formation of beliefs and delusions. And if you click on the red italics here, the original paper will pop up and you can review it at your leisure. So let's go on to the next slide. The hypothesis then stated briefly is hallucinations or percepts without external stimulus may arise when strong priors cause a percept in the absence of input. So the emphasis is on strong priors. So if a brain is constructed in such a way as to put a lot of credence into priors laid down by previous experience, then this would be a susceptibility to experiencing auditory hallucinations, and this may in fact drive the symptom in patients prone to schizophrenia. So here are a couple of references that have debated this before, namely whether patients with psychosis have strong or weak priors. And this paper puts this discussion to rest, I believe. So here then is the setup. You see that people are exposed to a checkerboard followed by a sound right here. And you can do this again. You fixate on a cross, then you see the checkerboard again, and the sound occurs again. So this pairing of the checkerboard, the visual input, and the sound constitute the the Pavlovian training and the linkage of a visual stimulus to a perceived sound. Now here then is the test. You see the checkerboard, and in this case, there is no sound. And then the prediction would be that patients who experience hallucinations, or perhaps even non-patients who experience hallucinations on occasion, may respond differently than those who never have hallucinations. Now the first thing that these researchers did was to do some classical psychometric analysis, namely, what is the sensitivity that is required for people to hear the tone? And these are very classical principles in psychoacoustics that have been well studied. And so you can see here that as the trials go on, there's a different sensitivity that is reached. The probability of detection by the tone is different according to which group you belong to. The next slide is the finding. So here is the detection threshold, which is a measure of how prone the brain is to perceive a sound that was never there. So here is the group of people that have both psychosis and hallucinations. And here is the threshold. It's rather low. And here are the people who have no psychosis, the psychics that the researchers were able to identify, and yet their threshold is quite low compared to those psychotic patients which never have hallucinations and normal controls. So this is then the separation that separates these groups, indicating that the thresholding, the detection threshold, is a sensitive function of either being diagnosed with a psychotic illness and the association with auditory hallucinations, or being a non-psychotic patient who also experiences auditory hallucinations. So here then, in the next part, is the probability of awareness, of answering yes to the stimulus, to the absent tone. And again, the yes answer is much more common in people who both have a diagnosed psychotic illness as well as report auditory hallucinations as part of their illness. So here then is the difference between hallucinating and non-hallucinating groups. These differences were found only when the tone was either absent and you had to hallucinate the tone from pure cloth, or if the tone, if the 25% likelihood was set as the cutoff. And these two findings here separate the patients with strong priors to those which don't. So in other words, the no-tone paradigm is the most powerful, but the 20% likelihood also will differentiate the groups from each other. And on the right-hand side, you see a elaborate table that breaks down the likelihood of answering yes, having heard a tone yes or no, according to group membership as indicated above, namely psychosis plus auditory hallucinations and all the other designated groups. Now, where does this take place? And just like in the other meta-analysis that I showed you before, it's in the auditory cortex, of course, here and here. So this is expected because that's where the action is. But consider this for a moment. Hallucinations are not something out of thin air. They are actually related to and produced by activity in the auditory cortices. Now, there are some prior switching stations before the auditory signal gets to the auditory cortex. The cortex is organized in a hierarchy, and so the priors laid down in higher regions of the cortex may influence the processing in the lower stations before the signal arrives at the auditory cortex. Now, there's one interesting corollary, and that is there is an error detection circuit, namely the anterior cingulate cortex. And the anterior cingulate cortex is decreased in activity in those folks that have hallucinations. So the auditory cortex does not do this in isolation, but there may be an interplay with other cortical areas, in particular with the anterior cingulate cortex. So the hallucinators were much less likely to engage the anterior cingulate cortex during the correct rejections. When there was no sound and the subject would say, "I did not hear any sound," this was done in some way not engaging that error detection mechanism that normal subjects usually engage in, namely the anterior cingulate cortex. Now, the authors then went ahead and used this data in a computational model. Now, this is quite elaborate and we cannot get into the total details, but just to remind you what the predictive brain scheme has in mind. Namely, there are prior beliefs indicated here by a Gaussian distribution, and there are the sensory evidence coming in to collide with the priors, and then you form a posterior belief after you have done your Bayesian statistical computation. In one of our lectures, we have told you that 12-month-old infants use this particular calculation in their brain to detect anomalies in their environment. They have an inbuilt sense of physics that objects are solid, and if you draw away their support on which the object rests, the infant expects the object to fall down. If this doesn't happen, then all hell breaks loose in the infant's brain, as indicated by gaze direction. Now, here are different ways in which this can play out. You can see sometimes the Gaussian distribution of the sensory input is quite tight. So there's high precision coming in through the sensory channels. And you can see that, of course, the posterior then is very sharply defined. You can have another situation where the sensory information is spread out, the statistics is not as tightly organized, and the priors likewise are spread out and are not well defined, in which case you get a smeared out posterior information or posterior belief or sensory detection. So this is kind of the Gaussian statistics of priors and the incoming information, allowing you to calculate in a Bayesian fashion the posterior belief or the posterior detection of a signal. So here's a more elaborate representation of this by Dr. Friston's group, and Dr. Friston is the key figure in the Bayesian brain world. He has an extensive mathematical background, having been a physicist before he went into psychiatry and neuroimaging. The important thing is this parameter here, nu or nu. We will transcribe it as V later in the next slide. And you can see the same mathematics is in place here, the empirical prior, the likelihood of the information according to the prior that you have laid down, and then the signal in the posterior that is your decision as to what you saw or what you believe. So now here, the group in Yale used the information that I showed you earlier, the yes or no answers basically, and the detection threshold data, to feed it into a statistical and computational network that uses the Friston approach to Bayesian processing in the brain. And so the first thing, of course, is to feed in the information, the map from experimental stimuli to observed response here at x1, and then the stimulus contingency is elaborated here, and there's a volatility measurement as well, and eventually you get a response. And the statistical difference is right here. Namely, it appears that the weighting between sensory evidence and perceptual beliefs parameter nu, is significantly different in patients with psychosis who experience hallucinations. So this finding then is interpreted as being consistent with a strong prior theory of psychosis. Interestingly, if you watch the video that Dr. Cortlet has done on the delusional beliefs and the fixation of delusional beliefs, the same idea appears to be operational, namely that strong priors will lead you to form delusional beliefs much more easily than if you were operating from a more balanced view and you are considering the data coming in to update your priors on an ongoing fashion. There are additional slides here that you can access through the presentation that is added in brackets as you click on this video on our website to dig deeper into the mathematics of this. So then, let's summarize. What this group has shown is, number one, almost everybody can be subject to experiencing auditory hallucinations, hearing things that are not there if you are trained to expect a sound in the Pavlovian paradigm. So your detection of truth, what is out there, is not always reliable and can be fooled if you train up your brain to have strong expectations, in other words, strong priors. You may see or hear things that truly aren't there. And the mechanism invokes the same brain areas that you use to perceive things that in fact are there. So that gives you a hint as to why it is so difficult to talk somebody out of a hallucination or delusion, because they really perceived it. It's not like some vague event coming from the outside. No, it's generated in the same machinery in the brain that true perceptions and true beliefs are generated. And how is the brain to tell which is which? Because it does not have access to the internal computational liabilities that it came with, namely a strong sense of priors which is not adequately updated by newly incoming sensory information. So stay tuned. There will be more forthcoming about the Bayesian approach to explaining symptoms in autism and other psychiatric disorders. Thank you very much for your attention. We see you soon again at a lecture here at Behavioral Health 2000.